Joining us now to talk in more detail on this, John R. Graham, the Senior Fellow at the National Center for Policy Analysis. John, we thank you for spending some time with us. Tell you what, I'm going to read these one by one and let you comment on these things if we can, John, as we welcome you to our program today. Number one on the list in the 8 myths of Obamacare: if you like your plan, you can keep it.
Well, thank you for having me on. I mean, that is a claim that's been made again and again and again for 4 years now. So far, we've had 6 million cancellations. The administration trumpets that they got 8 million and change people signed up in the Obamacare plans, but that was a real lift for them. A lot of sales and marketing expenses to get people signed up, most of whom are getting tax credits. And of that 8 million, about 6 million of them are people who had their plans canceled that they had in 2013, so it's not really a net improvement. And we're not done yet. Through 2014, people in small businesses especially are going to start seeing their plans get canceled and their businesses having to make serious adjustments to their coverage.
Number two on the list: if you like your doctor, you can keep your doctor.
Well, that is such a grotesque claim. You know, I've been spending a lot of time looking at California, where a lot of the Obama exchange enrollees got signed up. 70% of physicians in California are not in any of the health plans that are available on the exchange. If you're in Los Angeles County, the largest, best-known, arguably best quality hospital is Cedars-Sinai Hospital in Los Angeles. It's not in any health plan that's available on the Obamacare exchange in Los Angeles County. So these are very narrow, skinny, junk insurance plans that are available on these exchanges.
And number three, there's an employer mandate to offer affordable coverage.
Well, yeah, I mean, this is bureaucratic speak, affordable quote-unquote coverage. There are a lot of loopholes that employers who are suffering under the burden of Obamacare regulation can do to get away from offering coverage. And we think because of the costs of complying with Obamacare so much that businesses that used to offer some kind of coverage are going to cut back on that. One thing they can do, of course, is cut back on full-time to part-time hours. And I just read this morning, it wasn't in the report I put out, it just came out this morning, but there's a new survey from Aflac, the benefits company, that in 2013 they saw 14% of employers said they cut back hours for employees to roll them back from full-time to part-time. And this year they think 12% more employers are going to do that. So that's one problem there. Other things you can do, if there are plans that are defined by the government as affordable that can cost an employee up to 9.5 of his or her income just for the coverage without even paying the deductibles and co-payments, and those can be considered affordable, quote unquote, but they're not affordable to anybody who's earning a middle-class income.
And I have a
and
follow-up
those people
question.
will be forced to go to the exchange, and they're not going to get any subsidy or tax credit in the exchange, and we're going to see that in 2014.
I had a follow-up question also as far as the larger businesses that are supposedly providing health care. The penalties for not doing so are actually much more affordable to them than actually doing the coverage. So do you think we're going to see a lot of companies doing that? And if so, should there be stricter penalties?
Well, there are some, I'm not saying, I mean, there's an economic reality to Obamacare, and there's an economic reality to the whole economic policy of the Obama administration, which discourages companies from hiring people and discourages businesses from growing. So, you know, you just put another penalty on them, increase the penalty, that's not really going to help. That's just going to cause them to reduce their businesses even more. The Standard & Poor's 500 company, which organizes the index of the largest companies, their analyst said 90% of employees of S&P 500 companies, the biggest companies in America, 90% of those people within the next 5 years or so will lose their employer-based benefits as a consequence of Obamacare. So there's a lot of research done by very credible sources who are not politically motivated in any way that are telling us that over the next few years, employers are going to just keep looking at their benefits and start cutting them back and dropping benefits for employees.
All right, John, let's keep moving through the list here. We're on to number 4 now. And one of the things that we heard during the hard sell of Obamacare back in 2009 was that health reform would lower the cost of health insurance by $2,500 a year for the average family. And in many cases, we're seeing quite the opposite.
Well, exactly. We're already seeing quite the opposite. I mean, people and businesses have already seen that that's a myth and a misrepresentation. There's other costs that are not directly seen in the premiums, but they're hurting people. So there are so many taxes laid onto Obamacare. One of them we almost joke about is the tanning salons. You know, they have an excise tax placed on them.
Medical device
that's
tax
kind of
as well.
at the outer edge of things, but all medical devices, prescription drugs, health insurance plans, they all have excise taxes laid upon them that increase the cost of health care, and those are rolled into the cost of the premiums. And some of the incentives in Obamacare that look like they're a benefit will actually have hidden costs. So, for example, there's a lot of subsidies. There's the Medicaid expansion that many states undertook. And the Congressional Budget Office estimated that in the long run, 2.5 million fewer people will have jobs in the years to come than if Obamacare had never been passed. So even if those people can get on Medicaid or get a heavily subsidized health plan, I think they'd rather have a job instead.
Sure.
And number 5 on your list, there's an individual mandate that ensures everyone has health coverage.
Yeah, well, that was something that got a lot of people upset, and justifiably so, because the government shouldn't be able to order you to buy a private product. But for 2014, at least, they've kind of given up on that. You know, if you're applying for Obamacare and you check the box saying, I don't understand what you want me to do here because your website is so bad, they're not going to come after you for the penalty. And I think the mandate, the fine, which was going to be up to $95 this year, I don't think they're going to come after people for that. But they'll come after people. They'll come after people for that probably in 2015 or 2016. You know, if Obamacare sticks and Republicans aren't able to repeal it. But the problem with, I don't like the mandate, but if people see they don't have to pay the mandate, then the healthier people won't sign up, and it exacerbates the problem that we've identified, that the people who are signing up for the Obamacare plans are very sick, very expensive, and the healthy and young people are avoiding the plans.
Now, John, number 6 on your list is something that has been trumpeted a lot as if it is now fact. Yeah. And number 6 is this: individuals cannot be denied individual coverage due to pre-existing conditions. That's a myth?
Right. Well, it's a myth in the sense that for almost all Americans, that was a fact of life before Obamacare. You know, if you had employer-based coverage and got a new job, or had employer-based coverage and went into the individual market, that protection existed for you. It was called HIPAA, and the associated provision was called COBRA. Most people are familiar with those terms, even if they've never taken advantage of them. A very small number of people who were in the individual market and had to get another individual plan or had a lapse in coverage for some reason, those people would get underwritten. That's the term in insurance. You get underwritten, and if you have a pre-existing condition, there's either an exclusion for that or charge a higher premium for that. But when you look at, before Obamacare came in 2014, they had something called a pre-existing condition pool that the federal government funded, and it invited anybody who didn't have this, who had this problem, to apply. They only had about 33,000 people sign up for that out of the whole nation.
Wow, that's really important to realize. Listen, we've got about 2 minutes left and 2 more of the myths. Sure. Morgan's going to get to those quickly. If you can give us about a 30-second response on each. Morgan?
Yeah, number 7.
Yeah, absolutely.
Number 7 is healthcare insurers no longer can cancel a policy after an insured individual gets sick. Now, this has also been around for decades, correct?
Always illegal under state law. In 2008, HealthNet, a big insurer in California, was forced to pay $4 million in penalties and reimburse $14 million in medical claims. And state insurance commissioners were ruthless about that before Obamacare came in.
And finally, number 8, and this is a good one, Medicare has been strengthened. Your response?
Medicare has been weakened. Medicare has been weakened. $715 billion over the next 10 years cut from Medicare to pay for Obamacare, and people are losing their Medicare Advantage plans, which are private plans within Medicare that give good coordinated care. People are going to lose them, so it's bad.
Well, John, it's a long list, and Morgan, we thank you for helping us detail that, especially that last one, John Bogman. Medicare will be strengthened. There's only a certain amount of money.
Well, following up on that, we've seen the results of what's happened in that special congressional election, 13th district in Florida. That was a big issue there. The cuts to Medicare Advantage are going to be a huge issue in this election cycle, maybe in 2016
One
as
out
well.
of every 2 are supposed to lose it. I mean, half.
That is B-A-D, bad.
Yes.
Any way you want to spell it out. Hey, you can spell out your thoughts on the future of Obamacare. We'd love to get your comments. Why don't you tweet us what you have to say at Newsmax TV, hashtag America's Forum. There's also email. Our address, connect@newsmaxtv.com. And let's not forget Facebook, y'all. Facebook.com/Newsmax. We're coming right back with more on America's Forum.